pretty good with heels until I have to like walk up on a stage after Joe Tinnervin talks about me like that. Like my knees are shaking a little bit. And that was really lovely. Thank you, Joe. And I feel like my presentation is over. Joe just like covered, pretty much everything that I had to talk about. I really am humbled by your words, and I feel just like Joe. I feel incredibly lucky to have the job that I have and to be able to work with the teams that I work with. And I think that really says something about our company. We are so committed to the work that we do. It's a personal passion project for me, as it is for Joe, for a lot of the leaders, and for our staff. And I'm super grateful to our staff who's sitting in the audience today. I really want to appreciate you, Molly, Marina. You guys have been amazing, and your support system. Thank you so much for helping us put this together. I really appreciate you. You just shine here like you do every day at Casa Palmera, and so I just wanted to appreciate you. Thank you very much. Those were a lot of fancy words, but what I really want you to hear from me or about me is how grateful I am. I'm incredibly grateful to be standing here today, kind of coming together in community, as Joe referenced. This is one of our first opportunities to come together like this, and it feels very powerful, and I don't take this lightly. The last few years have been very challenging for us, and that's part of what I'm going to talk about today. It's part of the Emergence story. I did want to just give you a little background about how Emergence came to be. Jeremy and TJ have done amazing work in putting together conferences very similar to this in Northern California. And I was lucky enough to participate in those and found tremendous value in the concept of community coming together in a little bit different way, right? We're kind of thinking outside the box. We're looking at things through a different lens. And so there's always been this kind of thought process that perhaps we could recreate that here in Southern California, as TJ and I are recent transplants, and we're trying to tug Jeremy this way. And we really wanted an opportunity to create community in Southern California the same way we had enjoyed it in Northern California. And so, interestingly enough, TJ and I were having lunch. It was just as California was beginning to open up. And I remember it very specifically because we went out to lunch, and we kind of had to jockey around to make sure that we could find a restaurant that was open. We had to eat outside on the patio. That was fine. Everybody was still masking. It was a big deal to be out in the world. And after lunch, we wandered around, and we were talking about kind of the changes and the challenges and the opportunities that have been presented by the pandemic, which was really interesting. It was the first time I think that I'd actually had been able to stop kind of all the operational madness that we've been living through for the past few years and really just kind of get centered on the concepts of how this is going to profoundly change us, right? This is not an intermittent issue. This is something that is going to fundamentally shift the industry and how we do business. And so I think that was kind of where our conversation was, is like, how do we emerge from this? How do we come back to life in a way that continues this healing journey for those that we serve, allows our community to come back together in a more healed way, allows us to respect and honor each other in our industry for the strengths and values that we all bring together and clearly share. We wouldn't be sitting in this room if you didn't share the values that we all have. And so through that process and wrapping Jeremy in that conversation, it was like, well, here's our opportunity. Here's our opportunity to have this conference, to bring people together, to share ideas, and to really live in community. And that's what today is really all about. And so my intent is to really embark on a conversation this morning. If there's one thing I know, it's that I am not the expert in this room, but I am certainly smart enough to call on the experts. I have amazing teams because I recognize their goodness, their brilliance, their innovation, and I'm super happy to help nurture that and call that forward. And I'd really like to do that in this room today as well. You know, I have a few bullet points and I have a little bit of data, and you know, my intention was absolutely to get up here and just kind of wing it and not need any prompts, and I don't need the PowerPoint, and I'm just going to kill this. I'm just going to get up here and speak from my heart. And the reality is that I really like to talk about the tangibles. I like to talk about the data. I'm a bit of a data geek. I really like to talk about the statistics that drive the work that we do. I like to tell the stories of the humans that we touch, but I also like to look at the mechanisms and the science behind what we're doing. And I'm sorry, my aging brain will never handle all that data and be able to speak it to you in a way that is intelligent and interesting without having some notes in front of me. So I don't have a PowerPoint, but I do have some bullet points. So forgive me for that. Joe mentioned, you know, just as you're getting ready to step up to the stage with your PowerPoint all ready to go, you know, you have that once annual computer update that takes place like 30 seconds before you walk on stage. It's like, you'll be down for the next 48 hours and 6 minutes. It's like, wait, what? So I don't want to depend too much on my notes ever, but today it's important for me to share really where my thoughts have been in thinking about this. So, you know, we have 4 amazing speakers today, and my goal is to kind of talk about emerging trends in our industry. And it's hard to do that without putting it in the context of the pandemic, because that's simply where we live right now. We can't talk about anything without talking about the pandemic, right? It has invaded everything. It has infused everything. And frankly, it has created innovation in our industry that we would not have seen, or maybe it would have taken many more years to see without the propellant of the pandemic. Who'd have thunk it, right? But there actually has been some great innovation coming out of our industry. And so that's really what I want to talk about today. So, as I said, I mean, I think you know, the emergence from COVID-19 is a journey. There is no, I don't see a destination. In fact, this morning, New York Times headline said something about like, when does this end? Like, or are we at the end? And I'm thinking to myself, what is the end? Like, I don't see that being a thing. There's no destination, much like recovery, right? There's no destination here. This is simply a journey. And I think that in our industry, we're going to have to be adaptive and collaborative and thoughtful as we kind of step into this new reality. You know, and we're at a pivotal time in our industry. We're at a pivotal time in our country. So much is changing. Everything is truly in flux. But I do want to say this. I don't think we're at a crossroads. Like, we're not at a place where the road forks and we have to make a choice to go right or left. I feel much more like we're at a confluence of a bunch of streams flowing into a massive river. And that river is very powerful because of the contribution of all those streams. And that's really where I feel like we're at in our industry right now. And so part of that confluence is what we're doing today, coming together in community to discuss the ideas that are going to propel us forward and allow us to have a greater impact in the lives that we serve. You know, I want to be really clear about what my intentions are and my motivations. It'll make me emotional because my best friend says, "You're in a motor, my friend." I'm like, yes, I am. Like, I'll be the first one to cry on stage. But it makes me emotional because it's so important to me. You know, we do what we do. We all have our reason for doing what we do. I do mine because I'm a woman in long-term recovery, and somebody held out their hand for me. And I want to forever be the one holding out my hand, whether that's literally or whether that's figuratively or whether that's metaphorically, meaning that I'm helping to create access to care. That's what the bottom line is, right? That's why we're all here. And we have an opportunity, all of our little streams, to come together in a river and make a huge impact. And so I'll do that in every way every day that I possibly can do that. And that's by partnering with great leaders like Joe, great companies like Discovery Behavioral Health, and the rest of you who are sponsoring this event. But most importantly, it's by coming together and sharing our ideas. And so, like I said, I'll share a little data, I'll share a little stuff, but I'm really gonna lean on you, and I'm gonna invite you to participate. And I'm sure that, I'm sure that you didn't expect to come here and have to have a dialogue, but the reality is it's much more interesting that way. Like, you don't want to listen to me prattle on. So let's just, I just want to invite everybody to speak up. Let's see. So, the conversation is about how we can envision a new future for our industry. So I'm here speaking about this because I see challenges as opportunities. If there's a void, I want to figure out how to fill it. If there's a gap, I want to bridge it. If there's a need, I want to fill it. And that's why we're here talking about envisioning shifts for the industry. I know that we can shape shift, we can pivot, and we can grow. Just as a caterpillar emerges, you'll notice the logo was intentional. Just as the caterpillar emerges from its cocoon to become a butterfly, we too can create something limitless for the benefit of the people that we serve. And so, in kind of turning to these emerging trends, it's been really interesting watching what's been happening since the pandemic. The economic fallout from the pandemic has been totally destabilizing, not just for markets, not just for, commercial endeavors, but it's created this lack of safety that's fueling the mental health crisis that we're living through right now. And, concurrent to the pandemic, we're experiencing a global confrontation of social justice issues. I mean, every day, it's the headlines. It's kind of those two factors that are bookending everything that's going on in our world right now. But it's further shattering the illusion that all is well. We know that all hasn't been well for a long time, but it feels like the rest of the world is starting to wake up to that. Societal acceptance of behavioral health issues is shifting as well. This is something I'm super pleased about. This is one of those trends that I am really grateful to be seeing shifting. It's likely a result of professional athletes. You can name them. We have Olympic athletes. We have professional athletes who've been coming forward and declaring that their mental health comes before their competition. I mean, what a powerful statement that is. Right? You're going to put aside your Olympic hopes that you've been training for 4 years to take care of your mental health. I mean, we've never seen anything like that before. Maybe you would see an athlete prioritize their physical health and do some healing and take some time off the field, but we have never heard about that in our culture. We have such a culture of suiting up and showing up no matter what. We're going to come to work sick, and we're going to come to work broken, and we're going to do everything we need to do, and we're going to get it done. And I just, honestly, right, do we not? How many times have you all come to work with the flu? Just raise your hand if you've ever been to work sick. Come on. Okay. So all of a sudden we have people saying, I'm not going to go to work sick. I'm not going to go to work sick anymore. We ask you to not come in when you've got the sniffles, and now we're asking you to not come in when you need to take care of your depression, your anxiety, your substance use disorder. We're asking you to take care of yourself, and it's being accepted. Imagine that. We're finally mainstreaming the concept of seeking help, of stepping back, and of accepting intervention. Where are the interventionists in the room? Right? We're actually seeking you out. We need you on the daily to help us make connection in our community. So I'm going to quote, bigger than just the growth is the mindset change that's happened in society, says Allison Watson. She's the CEO of Modern Health. Love a woman CEO, just saying. This pandemic and everything else that's been going on in the world has created a level playing field to the extent that while not everyone deals with the same thing, there's that ability to empathize that everyone struggles or is struggling in some capacity. Pre-pandemic, it just wasn't like that. And we know that to be true. Like, our compassion reservoir is much deeper than it was pre-pandemic. We are much more willing to be accommodating for the next human because we know that they're struggling with something, because we've all struggled through this together. We've had to recognize the struggles in a way that have never been outlined for us before. So for our industry, these spikes in anxiety and depression and addiction as folks are navigating the upheaval has caused a drastically increased demand. So estimates are that 1 in 4 experience a significant behavioral illness at some point, and stigma reduction at some level has created normalcy in seeking help. Those factors combined are causing our facilities to be flooded with inquiries. Is the phone ringing off the hook? Do you have waiting lists? Do you have empty beds? We do not. The phone is ringing off the hook. We experienced this firsthand. And I have to say that, just to step back to the beginning of the pandemic, while the rest of the world was home like baking and TikToking and Marie Kondoing their underwear drawer, we were full steam ahead. I mean, it was like, I kept thinking, well, surely any day now they're going to shut down our facilities. We're going to need to Marie Kondo the underwear drawer. Like, we're going to get back to priorities. No, we, in all seriousness, there was absolutely no breathing room for us. We charged right into the fire. I remember that whole period of time where we had to give letters to our staff, and we had to require that they wear their badges when they're transporting to and from work, because we knew that if they got pulled over out on those empty roads, they had to prove that they were essential workers. Can you imagine? We were the only ones doing what we had to do, us and the COVID teams. We were the only ones out there doing it, and it's taken a toll. I think that it speaks, though, to how many people are needing help and what this pandemic has done in terms of uncovering that need. I also think, and this is just personal, but I do think that it provided a little bit of cover for people who were seeking help. It was like, it's a lot easier to dip out for 30 days and have nobody notice when you're working from your dining room table than it is if you're like in the office every day, you know what I mean? Or expected to be out working in the world in your big presence and your, all your accomplishments. But the reality is it was easier for people to step away and take care of their mental health needs. And I'm grateful for that, because it's allowed so many people to take the care of themselves that they needed to. So no shuffling in sweatpants for us. It's been, 2020, 21. I remember in 2020 when we were saying, oh my God, I can't wait until 2020 is over. Like 2021 is going to be fantastic. And here we are. Oh my God, it's almost 2022. And we're still doing the same thing. We're still operating under COVID protocols. We're still working with mask mandates and employee vaccination issues, and we've got all kinds of things going on around this pandemic that it feels to me as a CEO like a full-time job on top of my full-time job. It just doesn't seem to be going away. But the reality is we're simply responding to this explosive need. And these patients are hurting more now than they ever have been. I am willing to bet that the patients you're treating are much sicker than the patients you were treating 2 or 3 years ago. I can certainly say that the ones that I see are much more broken. They have lower bottoms, they are much more physically ill, and they are much more tormented by the issues that they're wrestling with. And we are having to work harder than ever in the short time that we have with them to help them on a journey of long-term recovery. So if the need's not abating, the demand is in fact increasing, the acuity is getting higher, then we have to expand our capacity to meet that need. And I want to ask, in all seriousness, how many of you have been involved in facility growth, a merger or acquisition, or an expansion of service lines in the last 20 months? Like, how many of you have expanded? Look, easily half the room has expanded to meet the needs, which is amazing. And you all deserve a hand. I'm so grateful. So Mertz Taggart, the big mergers and acquisitions peeps, they just came out with their Q3 behavioral health mergers and acquisitions report, and it shows that 2021 is on track to eclipse the high water mark of 116 deals reported in 2020. So we've blown out 2020 in terms of deals. And the growth is being driven by a few factors. So one is the influx of capital in addiction treatment, lots of money right now flooding into the market, and a lot of it being used to do really crazy, innovative, cool things. And that fills my heart because I know that it's for the benefit of the patients. Investors also have a renewed confidence in behavioral health, which I think is a little bit interesting. I wonder if it's a coincidence or if it's confidence in what we do, or if it's recognition that our services are literally invaluable right now. Like, we must have these services. And so it's either private investment in what we're doing, or there's going to have to be some governmental intervention. And so, the market is definitely shifting in a way to support what we're doing and scaling up. And the third is potential scaling back on the capital gains tax rate increase that was proposed by Biden. That seems like, an economic indicator, and it doesn't seem like it touches us in real time or touches the clients that we're serving. But the reality is that all those dollars, again, are being funneled to the benefit of the patients that we serve. So there were several critical deals that highlighted the nearly $3 billion in capital that was invested in the sector. So number one was Patient Square Capital acquired Summit Behavioral Health Care. And two was Lee Equity Partners acquired Newport Healthcare, which I'm sure you're all aware of. Those were kind of ground shakers, right? It was like, whoa, okay, if that's happening, then, what does that mean for us? And it kind of gets our attention because these big shifts in the marketplace are starting to indicate, where the focus lies. Right now, Taggart's identifying bandwidth of analysts and third-party advisors to be the only limiting factor between now and the end of 2021. So think about that for a second. That means there's literally unlimited capital out there waiting to be invested, but it's going to take analysts and accountants and attorneys hours to put the deals together, and we don't have enough hours between now and the end of the year to get the deals done. That's pretty powerful. That's a pretty powerful statement about where our industry has come. I remember when you were, robbing Peter to pay Paul in this industry, and we couldn't, there wasn't enough money to, pay people a decent salary, and, we were constantly on the edge. And now people are rushing forward with capital to make sure that we do a good job with what we're doing. So, while our mental health is more priority than ever, I think the need over time is driving greater investment in the behavioral health care delivery system, not just in our individual companies, but in the actual delivery system. And some thought is being given to what that organized system is going to look like. It's going to drive innovation in finding ways to scale. So speaking of capital and funding, I want to talk about the recent increase in federal funding for our industry. Is anybody funded by SAMHSA grants? Yes, no, some, yep, I know you are, Graham. And we talk about this ceaselessly at the state level. HHS, Health and Human Services, announced in June a $3 billion with a B in American Rescue Plan funding for SAMHSA block grants to address the addiction and mental health crisis for underserved communities. So while we probably have a lot of private pay and commercially funded programs in this room, or, hey, Dano, it's good to see you. Sorry, I just saw your face. Aw, it's really nice. I'm so glad you're here. So while we probably have a lot of commercial programs in here, a lot of us come from that nonprofit, that old school background where we're county funded programs. And $3 billion is going to go a long way in making a difference for those programs. And again, for the underserved communities, which is where it's needed more than ever. That's where the pandemic and the epidemic of addiction are raging together. side by side, and it's causing havoc. And that's where the dollars are most needing to be invested. So Secretary of Health and Human Services Javier Becerra, which we all know from California, has established a new Behavioral Health Coordinating Council, the BHCC. So the primary goal of the council is to facilitate collaborative, innovative, transparent, equitable, and action-oriented approaches. I love that. I'm going to borrow that for my next strategic plan, but those are his words, not mine. To address the HHS behavioral health agenda. I'm not going to get into the politics of the situation. I really, truly am not. But this is universally needed. And if the government can deliver on their promises, $3 billion with a B, I want a seat at that table. And if I can't have a seat at the table, I certainly am going to be paying attention to what emerges from these efforts. This is pretty significant for our industry. So while we're discussing governmental efforts to affect change, we have a new sheriff in town. And they're here to enforce the Mental Health Parity and Addiction Equity Act, which was passed by Congress 13 years ago. Can you believe it's been 13 years? It seems like yesterday in one part of me and like decades ago in another part. I mean, honest to God, parity was the big catchword. It was like everybody was talking about parity. It was such a big deal. And now we're so blasé to parity because we recognize that it hasn't been successful. Like that act was relatively... we couldn't defend that act, boots on the ground. And so I think that we've lost faith in the concept of parity as it was meant to be. But the act prevents health plans from imposing more onerous restrictions on mental health or substance use disorder benefits than those that apply to medical and surgical benefits. Sounds simple, right? We should all be treated equally. This should be a level playing field. But we all know that the cardiologists don't need a pre-auth before they treat someone for a heart attack, right? So this is what I get fueled up about, and this is what I speak about when I'm at state and federal level legislative roundtables. This is what I'm talking about because it gets me hot. If my dad has a heart attack, which he was immediately treated. Nobody stopped to ask what his insurance was. They took him right to the emergency room and they took care of him. And later down the line, we worried about that. But the thing is that I've got somebody who was literally coding yesterday and coming to detox to my hospital today, and I'm going to have a prior authorization before they can come in. Tell me what the fuck that's about. Yeah. Excuse me, but tell me what that's about. God, did I just say that in front of all of... in front of all of you and my boss. Okay, so all these years later, we finally have some teeth to this act. So the Consolidated Appropriations Act was signed into law at the end of 2020, and it gives power to the Department of Labor to enforce parity with mechanisms as simple as having to report noncompliance to all the plan members, meaning insurance companies, if they are not compliant with that and they are found guilty of not being compliant, they have to notify their members that they are not compliant with the Parity Act, which is pretty powerful. Nobody's going to want to admit that, right? They've been able to get away with it for a long time. And trust me when I say this, like I get hot about this, but I want to partner with these insurers to make sure that we are providing the best possible care. I'm defensive because we've been pushed into a defensive stance. But the reality is that we need to come forward with our hand out and work for a solution. And that's what this is all about. Ali Kawar, the administration's assistant secretary, said that he views this as essentially a human rights issue. No person who's struggling with addiction or another mental health issue is a statistic. These are real people with real challenges, and we can play a really significant role in improving how our system handles their care. That's pretty profound coming from an agent of the government. I mean, they're getting it. This is an emerging trend. We're being heard. It's been 20 years that we've been fighting for parity, and here we are. Like, we're being heard, we're being seen, we're being recognized as the experts in the field, as opposed to just those who are providing the treatment. So, 2 decades, yet in the ashes of the pandemic and through the needs of this nation comes the power to actually affect change on this. So, and as the health plans are being scrutinized, because they certainly are, they in turn are scrutinizing the outcomes of the treatment that we provide. One of the significant trends we're tracking right now is values-based contracting. Is anybody doing this yet? You guys doing value-based? We are too. So I want to welcome you to the next phase of contracting. It's going to be values-based. We're just dipping our toe in the water, and it's been a real learning experience. I've actually thoroughly enjoyed it. So as I said, I kind of fancy myself a data geek, and so I really dug into the scorecards that the insurance companies provide us, and I want to know exactly where that data is coming from. I want to know how they're measuring us. I want to know exactly what I'm supposed to be living up to, right? Because as long as I know where the goal is, I'm going to get across it. I think somebody called me driven. That's me, baby. I'm coming for the finish line. So I want to make sure that our patients are getting the care that they need, and it's being funded appropriately because we're treating them in the best possible way. And so I need to understand what those outcomes measures are. So as I started digging into the values-based contracting, what was clear to me is that despite significant efforts to quantify the outcomes of behavioral health treatment, this is a work in progress. It simply is. The contractors are coming forward with their best guesses, and we're meeting them with our best data, and together we're going to try to forge this path. Again, two streams into this raging river, right? We're learning as we go, and we have to come to the table to partner with the payers in a way that assumes responsibility for how we provide these services. How many times have I told the tale over the years, and certainly I used to do this at nonprofit. Somebody would call me up and go, a parent, it's always a parent, who would call up and say, but what is your success rate? And I would say, well, the national average is about 8% of people aren't relapsing immediately and coming back into treatment. And I try to think of a better way to contextualize that and have that conversation. I'd say, it's all just about harm reduction. We want to have an improvement in their lifestyle, and if we can do that, then they're better. If health outcomes are better. So I could talk this till I'm blue in the face about what these outcomes are, but now we're talking about actually using the data that's representative of our success with these patients to show what a great job we're doing. Right? We can do that. We can quantify it. I just want to make sure that we're using the right measurement to do that. I want to use the right tools, and I want to be judged on the right topics. I want us to be putting our money where our mouth is. So now we're not only mission-driven, we're outcome-driven. At the end of the day, I think we still have a way to go before that data will be the only indication of successful treatment. Long-term recovery here. I still look for the light coming on in someone's eyes. That's the outcome measure I need to see, right? That's why we all do this. So on to our next trend, the light coming on for our employees' eyes. How many of you are dealing with workforce challenges right now? Again, at least half the room. I'm guessing the rest of you don't have employees. I'm just saying, that's how serious this is. Right now, employee mental health and well-being has become a budget line item. I'm having to budget to make sure that I've got the resources to take care of our team. And that doesn't include all the leaves of absence, the going off and finding myself, and maybe I need a job and maybe I don't, and I'm going to just take a leave and I'll see you soon, and I'm going to just drop back to part-time. Per diem sounds good. One day a month. Yeah, that works. That works for me. It's affecting our bottom line. It's affecting our ability to take care of these patients. And don't get me wrong, I'm a CEO. I report to the big guy. The bottom line is fiscal, but the bottom line for us at Casa Palmera is our patients' health and well-being. And when I have a staffing shortage and I can't make sure that they're safe and well cared for, then we have to pull back our access to care. And that just doesn't work. It doesn't work when the need is expanding and we have all this capital coming in. We've got to figure out a way to connect the dots. We have to build bridges here, right? We have to figure out how to get our workforce engaged in a new way. And I had a conversation with one of our E-team a couple of months ago, and I said, we have an opportunity to come charging forth in a whole new way with our workforce post-COVID, if there is such a thing. But we have to start focusing on what it's going to take. We have to start reimagining the landscape, for lack of a better word. We have to take care of the employees who commit so much of themselves to the work that we're doing. I think we have to rethink what it means to have workplace loyalty. Like as employers, we're always looking for loyalty. It's one of the things I'm looking for when I'm going to hire someone. Like, are you going to stick around? Because I really don't want to invest my training dollars and all this onboarding, and this is expensive, and it takes a lot of time, and it's a lot of psychic energy, and we get attached to you and your kids and your family, and we don't want you to leave, and so we need you to stay. And are you going to stay? Because if you'll stay, I'm going to hire you. That's all I need. But I think what we have to start doing is looking at how we engender loyalty from our teams, right? It's not about the loyalty that you bring to us, it's the loyalty that we give to you. We have to take care of our people. Gone are the days of staff retiring after 30 years. That is not happening anymore. It is simply not. Today, the average for workers age 25 to 34 is 2.8 years. And I'm just going to say that seems like a long time to me. 2.8 years seems like a long time. Because people who I think are going to stick and stay and who really appear super committed to their jobs, their careers, to Casa Palmera, to DBH, they stay for a year. And they're like, no, I'm going to go, I've got a better opportunity, or I'm going to go do this, or I'm going to, it's not always about money anymore. It's definitely about finding themselves and having more meaning in the work that they do. Not that you could have any more meaning than what we do, but the reality is we have got to find a creative and innovative way to keep our workforce engaged with us, to create loyalty in a different way. We have to create a culture where our employees want to be part of our tribe. I'm going to ask you, what are you doing? What are you doing? I am asking from a place of genuine curiosity, because I'm going to steal your idea. I need to know what you're doing. How are you keeping people engaged? What are you doing? What's special about where you work or what you do? How do you keep your tribe together? We have a mic. Jeremy will pass it around. You what?
We promote within.
Yes.
People who've been long-standing therapists are now running teams and organizing trainings and, doing talent research and talent search. I don't need a mic.
Marion Ross has never needed a mic. I'm just saying. Yeah.
We're really highly organized women. We have a lot of women in our executive management team. We have a new CEO, and she's promoted within. And I'm clinical promotions. Clinical promotions within.
I love that.
A lot.
I love that. Thank you. I think that's super important. We have such a strong culture of promoting from within. That's where you find the light and goodness, right? Is your own people. If you didn't believe that, you wouldn't have them working with you. So let's expand that. Let's help them find their passion. Let's help them find that light that burns brightly and fuel it. Let's give them all the resources that they need to be successful, because that's what this is all about. Anybody else have some brilliant thing that they're doing to engage? Yeah. Karen.
I'm not sure I need this either, but I think leading by example. I think that's so key to maintaining staff, because they see you doing it, they see your passion. I've never heard you speak, Jen, but I'm so excited because you're so passionate about what you do, and I think that translates to our staff. It motivates them, it ignites them, and it gives them purpose. So,
thank you.
Fine.
I love that. Dr. J.
I apologize about the phone. I got another new phone and
Okay.
I shut off. I apologize.
It's all right.
I had mentioned a Graham earlier, and I'll tell you. Oh, here with that gray suit. I'm not being a cougar. I just love clothes. Okay. So that call was a major company in the U.S. who just hired me to train their addiction counselors in telemed. Now, this is the smartest thing happening. Why? They have experience with the employee. They know who the employees are. Why go out and hire new telemed people when you have excess staff and you can train them to do the initial assessments online? It's just phenomenal when you use that concept. So I just wanted to kind of kudos that. One, I've known her since she was in Chico. I love, appreciate, respect, and adore her. And I'm so proud of you.
Oh,
Yeah.
Dr. J. Aw. It's a love fest. It's always a love fest in my house. We love it. I appreciate all the feedback about it. I mean, we're using really creative stuff. You know, internally, I think we're using technology as part of our engagement, and I know that we're constantly, as a company, constantly adding to our opportunities to use technology to engage with our employees and our patients. You know, this is one of our next emerging trends, and it's here, large and in charge. So right now we're using our intranet. We host contests, and we get a little bit of healthy competition going between our different facilities. We recognize birthdays and anniversaries and highlight the outstanding work that's being done at our facilities and by our therapists. That's just one of the ways. At Casa Palmera, we just try to play a little bit and really feed a lot of people because we believe in food at Casa Palmera. So we eat a lot. We drink a lot of Starbucks. There's an employee recognition line that gets a lot of attention. You know, but let's talk about the technology for a second, just dipping into this. So telehealth and telepsychiatry, you know, perfectly segued by Dr. J. This one seems obvious, right? Zoom stock soared from $62 a share to $560 a share in 12 months. While we've used telehealth solutions in other areas of healthcare, you know, it seems to have taken a pandemic to reveal the benefit for behavioral health. And there are benefits and detriments. In a recent study by Yale University, the findings for adolescents in treatment through telehealth was really positive, amazingly so. Having a 17-year-old kiddo at home who did a year of school online, you know, there were benefits and detriments. One is like he never got dressed, and two is that, you know, I mean, it was good, but it was challenging. But their survey, and this is Yale University, found that their sense of safety increased because they're home, like they're in their known surroundings. They feel safe doing what they're doing. Convenience is primary. I mean, if it's not convenient for a 17-year-old, they're not going to do it. It just straight up. And brush your teeth? No, that's not going to happen. That would mean lifting the brush and doing the work. Ability to create a comfortable setting, like the patients at home surrounded by their familiar environment, was really helpful. Kids can play online with the therapist. They do video games. They use video games with the therapist to communicate. Like, how freaking ingenious is that? Like, why didn't I think of that? And then, of course, there's that opportunity to peek inside the home, which we heard a lot about from teachers during the pandemic, was they got to see what the home environment was like in a way that simply had never been seen before. You know, and of course, nothing replaces the human connection. Virtual services have been life-saving, literally life-saving over the last, 18 or 20 months. But the limits are inherent in a virtual experience. We're challenged with it at IOP. We had a pretty robust virtual IOP program going on, and the minute we let people back in, boom, it was like to the walls. We were packed because people were so hungry for the connection that we're enjoying here today, right? That's what this is all about. So where technology has expanded connection is the use of apps that have been created for this space. Have you guys recognized all the apps right now? Oh my God, there's every kind of recovery app you've ever heard of, ever thought of. And again, I'm like, why didn't I think of this? Like billions in investment dollars. So in the first half of 2020 alone, digital behavioral health startups scored $588 million of funding, roughly the annual funding for that segment in any previous year. We use an alumni app that creates social connection for our cohorts, which is really fantastic. It allows us to push out information for our alumni and our families. It's a little bit like Facebook for alumni. It's so fun, and the staff gets to engage too, so we have this really great conversation going on. And what's really awesome is that when somebody's struggling, we can recognize it and come right alongside to help, to provide resources, whether it's with us or somebody else. We can quickly recognize where the challenge challenges lie. Technology is being used for referral platforms, digital symptom tracking, sober living behavioral alert systems. What about virtual reality for mental health? What about that? What about virtual reality for mental health? That is fabulous. I know my kid would do it in a heartbeat. Like that, he'd sign up to do that. I mean, talk about a completely innovative and out-of-the-box way of thinking about how we're providing services. Research shows that VR tools can successfully treat anxiety, phobias, post-traumatic stress disorder, among other conditions. Medication management systems are virtual now, and there are several AI chatbots like WeBot and WeSa that can help patients practice CBT strategies and manage their symptoms between appointments. I'm curious what you're using. Anybody doing something crazy? No tech wizards in the audience? All right, so finally we're expanding our clinical capabilities to include a variety of therapies. So while 12-step is still foundational, it always will be. It's in my heart. I know it's in yours. We are currently wedding science with spirit to provide the greatest opportunity for healing. So we're using neurotherapies. We're doing this at Casa Palmera. I invite any of you to come and see what we're doing. Very exciting. We're using transcranial magnetic stimulation, TMS. It's a non-invasive mental health treatment that we're currently using to treat medication-resistant depression, anxiety, and a couple of off-label things as well, one of which is executive functioning. I keep threatening to go down there and get a session myself. But we're using TMS, ketamine, and other new modalities are emerging. You know, we're rethinking how to provide services and who will provide them. We're engaging all levels of workforce to bring transformation. Psychiatrists are working alongside peer support specialists, and the combo's nothing short of magic. There is that combo of lived experience partnered with science. There are new modalities like conscious recovery. They're providing a values-based and heart-centered approach to healing, and we're embracing it all. We're doing all of this. I know that you are too. And I look back at the trends that I've just talked about. So expanded demand, influx of capital, increase in federal funding, values-based contracting, bringing value to our workforce, technology, and I realized that the one trend I value above all others is collaboration. It is the unquantifiable and yet most important value that I hold dear. I seek the knowledge and wisdom of others who've come before me, the lessons of those who have failed along the way, and I want power in numbers and strength at the table. And that's why we're doing Emergence today, because we want power in numbers and strength at the table. We want this brain trust to come together in conversation to create the emerging trends instead of waiting for them to happen to us. I'm super grateful to be here today with you. I look forward to seeing you at the break, and I can't wait to hear the rest of our speakers. I'm so grateful that you would spend an hour with me and allow me to share what I see as the emerging trends, and I'm just extremely grateful to be here today. Thank you.